Newly diagnosed myeloma is always one of my favorite topics because things are changing rapidly. I think one of the things that we know is that getting patients on treatment is important when, of course, they meet criteria. And so now we know that not only do we look for a clonal population with end organ damage, so the CRAB criteria of hypercalcemia, renal insufficiency, anemia, and bone lesions, but also the SLIM CRAB criteria, which incorporates the light chain ratio of involved over uninvolved of 100 or greater, or marrow infiltration of plasma cells 60% or more than one MRI-based lesion, which is usually a marrow-based lesion. Now, it's hard to always know these things up front. The most important thing to do is a full evaluation to make sure you've looked for all of these things and to keep these patients under surveillance if you think they may have smoldering disease. But if they have any one of these 8 criteria or 7 criteria, it's really important to consider starting treatment. Why? Because we don't want anything bad to happen to them. We don't want them to break a bone or to have renal insufficiency. And now we have so many drugs that we can use. We know that 3 drugs are better than 2, but we also know that it might be that 4 drugs are better than 3. So we look forward to data from things like the GRIFFIN trial and Perseus trial, looking at Dara-based combinations of 4 drugs versus 3 with transplant, and other trials that have looked at this without transplant to see if we can have duration of therapy as long as possible in that first induction, transplant, consolidation, first line of therapy for myeloma patients.